before you got to MedPAC, any just fundamental lessons you learned from those three government postings that have carried on through MedPAC and now at Arnold Ventures?
There was a lot of similarities in the sense of trying to be the person in the room that, worked off of evidence, looked for a logical policy, looked for a compromise, looked for a way to get things done. But differences between them, OMB had, there were a lot of analytics, and there was a very kind of rigorous process of going to reach, say, a position on the part of the administration, and sort of looking across all the different agencies and pulling and information and pulling all that together to have an administration position. CMS was about implementation and, really a different role altogether, as opposed to just, making policy, coming to some kind of political agreement. It was actually operations, education, implementing the policy. And then CBO was much more analytic and sort of exercised an influence almost indirectly by saying, well, this is what the evidence is. This is how we think the world works. So this is how we would model or score this particular piece of legislation. And of course, that had a big impact on what direction the legislation went in. The amount of dedication and professionalism of the staff in all three of those places is stuck with me. People who worked and gave large parts of their life to get things done, working late, working weekends, working nights, that type of thing, and caring deeply about the mission of whatever of those three organizations. That was, something that was actually really inspiring.